I'm Dr. Barbie.
So you're primarily going to be focusing on the prime mover, the main muscle that moves something in a particular action. A lot of muscles have other little muscles that help them do the same actions, called a synergist. Sometimes you have muscles that help stabilize the origin. Those are called fixators. You may have noticed that if you're doing sit-ups and you tuck your toes underneath the edge of the couch or something, then you can use your legs to help fixate your femur while you're doing your crunches, and help fixate your pelvis while you're doing your crunches and getting your abdominal muscles, giving them a workout. We're going to focus primarily on the prime movers and the antagonists. And so in that event, you might want to learn about some of these muscles in groups instead of as individual muscles. As a group, your abdominal muscles can compress your abdominal cavity, and they can also flex your torso at the waist. So those are the actions that they would have. There are subtle differences between them. The transverse abdominis is doing a lot of just compression and not so much flexing. The obliques are helping you to do those twisting types of crunches. So sometimes when you're doing those exercises, you won't just do sit-ups just going straight up and down working on the rectus abdominis, but you'll do some twisted or crossways crunches to work on your external obliques, which wrap around and help a lot of your posture. Some books, like the blue physiology book that we have available in the classroom, have a little chart that'll list the name of the muscle, how to pronounce it, the location and description of it, the origin and insertion, the action, and they also include what nerve is innervating it to make it contract. They usually do not include the antagonist, but that would be something you'd have to determine based on the action. What is the opposite action? Reading these is pretty clinical, and I would recommend when you are creating your video, you don't copy down and read exactly what it says, but you try to summarize it into what you understand, and you try to actually do the action so you can show someone in a video how that muscle functions. So don't copy down information verbatim, and don't read the information verbatim, but truncate it into something that is meaningful and that you understand and will help people remember it. To figure out the antagonists, look at the actions of the muscles and then try to think, what does the opposite action? Here are the muscles that called the erector spinae that go along your vertebrae. They work at different places to extend your torso back up again. So as a group, the erector spinae muscles are a good antagonist for the whole abdominal group. Another action of your abdominal muscles is to compress your abdominal pelvic cavity. And so if you have this diaphragm, when you are inhaling, your stomach can go in and help push your diaphragm out. And when your diaphragm is contracting, it can also put some pressure down here and help push your abdominals out. So your diaphragm can kind of act like an antagonist when you do special breathing in yoga, or sometimes for singing, or sometimes for playing a wind instrument. You can incorporate your abdominal muscles to assist your diaphragm in helping you inhale and exhale. Or even swimmers, I think, might do that, or athletes that are working on their aerobic capacity.